Hi everyone, Dr. Amna Husain here, board certified pediatrician, board certified lactation consultant, and mom to two. Today we are talking about potty training. Alright guys, I don't know if I've ever done a video in the past on potty training. I'll be really honest, the potty training world can be a little intense. Everybody seems to think that their method is the best, and this is the best way to do it, and the truest way to do it, and if you do it any other way, you're just either making it complicated, making it hard, or you're, I don't even know, just doing it the wrong way, I guess. And I'm not here to really tell you a specific way to potty train simply because of that. Sure, the 3-day method does not work for me. I do not advise a 3-day method if I was a pediatrician to your child. For me personally, naked time did not really seem feasible. It wasn't really practical for us, so we didn't use that. For some families, that may work out really well. So you can see here that I'm trying to avoid talking about methods to potty train because I don't even feel that I am the expert in this really. Sure, I've had 2 children. I've potty trained both of them, thankfully successfully. There have been little pitfalls. There have been little roadblocks in the way. There have been regressions, all of which are normal. But I want to talk about 3 tips that I recommend as a pediatrician for developmental readiness assessment when it comes to potty training. So this is the video that you want to watch before you even begin potty training, because this is the pediatrician's green light to say you guys might actually be ready to potty train. Side note guys, if you hear beeping in the background, just understand that they are doing construction outside my house and I cannot control the sounds of beeping and trucks and chainsaws. I apologize, but let's go back to potty training. So first up, as a pediatrician, I'm looking for developmental readiness when it comes to independence. So you want a child who's able to try to take interest in putting on their pants and absolutely be able to pull down their pants. That's really, really important. So you can absolutely help them for pulling down their pants, but they should be able to understand, like, I have to pull down my pants to be able to go potty. And you're not going to really phrase it in that way, but maybe before bath time or something, you can say, let's take off your pants, and watch them and see if they can take off their pants for you. Now, you may have a child who's already at this mark and beginning to take off their diaper, which, you know, my thoughts and prayers are with you. I have been there and I don't want to go back to that. But if you have a child who's already starting to undress themselves, then you may have already hit this developmental readiness mark, because undressing themselves is really important when it comes to trying to establish potty training readiness. Now, I will say that there are absolutely countries in the world that skip this step completely and really do newborn potty training, don't buy any diapers, and are watching their child and are able to put them on the potty immediately. So this wouldn't apply to them. In this country, in the US, which is where I practice, we do overall do diapers and then move on to potty training at the 2 to 3, 2 to 4 mark. And I want to establish that there's nothing wrong with the first method if that worked for you and your family, no matter where you're watching from. But this is a method that's typically employed and things that we look for as pediatricians here within the US. Now, in that same vein of developmental readiness, we're going to move on from motor skills to communication skills. Now, that doesn't necessarily need to be speech, but your child does need to convey to you in some way that they are peeing or pooping. So that conveyance of pee-pee or poo-poo time, that is really important before you embark upon your potty training journey, okay? You have to be able to recognize if your toddler is starting to give you signs like they're gonna poop now, and okay, maybe this would be a good time to be able to catch them once we start potty training and put them straight on the potty. Now, if they're not really able to give you signs and you have no idea when they're peeing or pooping, then maybe you just kind of have to watch your child a little bit more, or ask them and then maybe they'll answer, right? It's not really our first inkling to ask your child, are you pooping? Or maybe it is if you're a parent. But if that's something that you are able to communicate with your child about and find out that they are about to go number 2, then you may be able to help yourself a lot when it comes to the potty training, because your child is already communicating to you right before they need to go sit on the potty that they do have to use it. My last tip, and this one has really been helpful, I feel like, as a pediatrician, but also as a parent to know, is to put them on the potty for a few months prior with absolutely zero expectations. So this may go against the people who recommend a 3-day method, which again, I'll reserve my thoughts on that. But when it comes to potty training, your child is going from diapers and doing a bodily function in diapers to all of a sudden doing it in a different place, in a different setting. And you want to have them be a little bit more involved in the process. And that means, let's say your child turns 2.5 in June. And you're like, yep, come June, I'm going to start potty training. I would say January, February, go out, buy a potty. Maybe buy a potty with them. If they love Minnie Mouse or Mickey Mouse or Cookie Monster, if they love Bluey, buy a potty that you can decorate with those stickers or that has that specific face on it. Something that's a favorite color of theirs, something that's inviting. And allow them to sit on it for a few minutes. Just sit on it, right? With their pants down, with their underwear down, and they could just read a book. Or you could just hang out for a little while and you could read to them. And this is a chance for them to just kind of get used to sitting here, because all of a sudden it's going to be a new place for them to do a bodily function. Now, if they end up peeing, fabulous. Maybe you bought that potty in February and you finally got around to putting them on it in March, and you do it a few times a week after their lunch or after their evening dinner. And then miraculously, the 3rd week of March or into April, they happen to tinkle. I want you to do a big clap, a huge reward, and just remind them, wow, that is amazing. That was like actually where it's supposed to go. Wow, you did pee-pee in the potty. It took 1 month, really, at least, right? The whole month of March for them to kind of get used to sitting and just being able to sit there and recognize, like, this is not an unsafe place. This was unfamiliar, but now I'm familiar with it. And that helps a lot, because one thing we do see as pediatricians is withholding. And we don't want to see urine or stool being withheld, right? Because that leads to, first of all, it's not really great for your pelvic floor. Second of all, it can lead to constipation. And constipation can have a lot of other downstream effects. Abdominal pain. It can cause them to really be afraid to go stool even in their diapers because they're so constipated. So I think being able to do this early on really, really helps to take the edge off and the unfamiliarity away from the potty. I hope this video was helpful. I know those were 3 tips and they seem like they were very low-key, low maintenance, but there was a lot tied into it because, again, as a pediatrician, we're looking at developmental readiness, motor skills, communication skills, but also we're trying to prevent something like constipation or an unfamiliarity or a scary sort of situation or association with the potty. I hope this was helpful. If you have questions below, make sure you ask them. If this video was helpful, give it a thumbs up and make sure you recommend it to another parent or friend who's about to start or going to consider beginning on their potty training journey with their little. Have a good one. Bye.